If you are over the age of 60 and struggling with recurring sciatica pain despite consistent stretching, the primary cause may not be a spinal disc issue. In various instances, the underlying problem could be a deficiency in a vital mineral that protects your nerves and connective tissues. My name is Dr. Thomas, and in this video, I will discuss the link between sciatica and a specific nutrient deficiency that is frequently overlooked by medical professionals. The information provided in the next few minutes may clarify why your discomfort persists and how you might achieve sustainable relief rather than temporary fixes. Before we proceed, I would like to know your location and age. Please share these details in the comments. This information helps me tailor future content to better serve your needs. Let's begin with a fundamental explanation of what sciatica actually is. This condition occurs when the sciatic nerve, the longest and largest nerve in the body, becomes irritated or compressed. This nerve originates in the lower spine and extends through the hips and buttocks down to the feet. When its nerve roots become inflamed, sciatica results. While stretching can offer short-term relief, the pain often returns because the root cause remains unaddressed. That's why today, Dr. Thomas will focus on potential root causes. In approximately 90% of cases, the issue involves the spinal discs. These discs act as cushions between your vertebrae. If the outer layer weakens, the inner material can bulge and press against nerve roots, causing burning sensations, numbness, or deep, irritating aches in the legs. During my research into nerve health, I examined a condition known as myeloneuropathy. This term describes a state where both the spinal cord nerves and peripheral nerves are damaged. The symptoms, such as burning sensations and muscle weakness, closely mirror those of sciatica. Remarkably, a significant number of individuals with these symptoms exhibit low copper levels. While deficiencies in folate or vitamin E can also play a role, copper deficiency is a recurring factor. I have found that copper-infused products, such as patches or braces applied where the nerve begins, can help manage inflammation. While some are skeptical, these products are low risk and affordable, making them a popular choice for those seeking additional relief. The use of copper for pain management is not a modern concept. Ancient Egyptians used copper jewelry to address swelling and inflammation. Modern science is now exploring this potential role more closely. Copper is essential for producing collagen and connective tissue. Given that approximately 75% of a spinal disc's outer layer consists of collagen, a copper deficiency can compromise disc stability. This weakness makes the disc more susceptible to herniation, which triggers sciatic pain. Furthermore, copper supports the health of myelin, the protective coating around nerves that ensures smooth signal transmission. So, why does copper deficiency occur? A primary reason is diet. Copper is prevalent in shellfish and organ meats, which many people rarely eat. Additionally, those who engage in intense physical activity or live at high altitudes may have an increased demand for minerals. High intake of zinc, iron, or vitamin C supplements can also interfere with copper absorption. Furthermore, processed foods, excessive sugar, and caffeine can disrupt your mineral balance. If you are looking for relief from sciatica, Dr. Thomas suggests these practical steps. You might try copper braces or patches to support the hip area. Simultaneously, incorporate copper-rich foods into your diet, such as liver, oysters, dark chocolate, and cashews. Under a doctor's guidance, copper supplements can also be used. Remember that stretching and physical therapy remain vital. Nutrition and movement work best when combined. When individuals correct a copper deficiency, they often notice significant improvements in their sciatica within several weeks or months. This happens because the spinal discs finally receive the nutrients needed for repair. However, maintaining balance is key. Copper must stay in the right proportion with zinc. Increasing copper intake too quickly can cause stomach discomfort, so it is always best to start slowly. To conclude, remember this action plan from Dr. Thomas. Evaluate your diet, consider copper supports for temporary comfort, eat nutrient-dense foods, and use supplements cautiously if needed. Continue your mobility exercises and be patient, as nerve and tissue recovery takes time. If you found this information helpful, please like the video and share it with others who may be suffering. For more health strategies, subscribe to the Dr. Thomas channel. Until next time, stay active and take care of your health.